Hello, my name is David Mason. I'm a family nurse practitioner student at the University of Auburn. I'd like to talk to you today about osteoporosis. Osteoporosis is a skeletal disorder where a patient loses bone density. The architecture of the bone is compromised and increases the risk for the patient to have fractures. Risk factors for this are going to be mostly females more than males, especially postmenopausal females. When individuals age 65 or older, individuals who smoke, heavy intake of alcohol, who have Cushing's disease, renal disease, gastrointestinal disorders that interrupt the ability to effectively absorb calcium or vitamin D. Other ones are going to be lifestyles such as sedentary lifestyle and a BMI of less than 21 or small-framed individuals. Key questions that you're going to want to ask during your examination is going to be focused on back pain, thoracic back pain or lumbar back pain that is only relieved in the recumbent position is a key. Diet, focusing on what are they intaking. Are they getting calcium-rich foods, vitamin D-rich foods? Also, are they active? Are they going to get out and do things that increase the strength of their bone, or are they sitting around staying inside or indoors all the time? Medication history is another key question you're going to want to ask them. Are they taking heavy doses of steroids recently or for long periods? Are they taking thyroxine? Are they taking phenytoin, which is another risk factor? And also you want to ask them about family history. Mothers and aunts and sisters who have osteoporosis are huge for key questions. And if they have those family members, then the patient is more at risk for having osteoporosis. Physical examination is going to be observation first. If the patient has kyphosis, which is a slumping over, you're also going to want to examine them for balance. Do they have balance issues? Because this puts them at increased risk for falling. And then if they have osteoporosis, then it's very likely they will get a life-threatening fracture or multiple fractures. You want to measure their height. Less than 2 centimeters from the previous height measurement is a risk. Also, 1.5 centimeter loss in height from the age 20 is a risk factor. You also want to assess their respiratory status. Patients who have kyphosis due to osteoporosis can also be an increased risk for infection because they cannot open or expand their lungs effectively, putting them at increased risk for pneumonia. Treatments are going to be lifestyle management. You're also going to want to put them on a calcium, 1,200 milligrams a day, 800 units of vitamin D to increase the absorption of calcium. Bisophosphonates increase the bone mass density, but these medications can have side effects such as hot flashes, night sweats, and thromboembolism. Raloxifene and teriparatide are also second-line medications. These medications have high risk for interfering with aspirin and Coumadin or warfarin. Teriparatide is a medication that anabolically stimulates the bone, and raloxifene increases the bone mass density. These medications should be monitored very closely and not continued for longer than 5 years. Teaching is going to be the key aspect to treatment for osteoporosis. First key point is smoking cessation. Also reducing or inhibiting alcohol intake. Safety is a big one. Patients who have osteoporosis can have increased risk of fractures. So you want to make sure that they are well balanced, that they have well-lit areas in their houses, they get rid of area rugs, that they use side or handrails when walking in stairs, they take their time for getting up, and they're very aware that if they get or have a concern that they have a fracture, that they report to their practitioner immediately. Weight bearing of 30 minutes a day, 3 to 5 times a week is important. Diet such as tunas, salmon, mackerel, orange juice, yogurts, anything that's rich in calcium and vitamin D are very important. Measuring their height is also important because that can indicate that they have an increase in osteoporosis. Thank you so much for letting me talk to you today, and I hope you have a great day.